If you Google BBL right now, you will still see article after article of BBL is the most dangerous cosmetic procedure you can perform, highest mortality rate of any procedure. And what you have to understand is you have to understand first the history of BBLs, how they were originally practiced, and then why they became dangerous, and how they should be practiced now. I do this procedure a lot. However, I do it safely. I love it when pop culture brings what I do, plastic surgery, to the forefront. This beef between Kendrick Lamar and Drake has brought BBLs to the forefront because of Metro Boomin song BBL Drizzy. So let's talk about BBLs, because that's what K-Dot is accusing Drake of having, which is BBL, a Brazilian butt lift. Brazilian butt lifts are a procedure that I actually perform quite a lot of. They were popularized in the last 20 years or so by the likes of the Kardashians, and the procedure is fairly straightforward. You are liposuctioning the body, taking fat from elsewhere on the body, usually tummy, sides, back, thighs, wherever you can get it, and you're injecting that fat into the buttock to give more fullness, more shape. For a lot of years, people wanted the biggest butt that they could get. That was the trend and the style. Now, BBLs have become less about volume and more about just giving a more hourglass, more feminine shape. Men, like Drake, are even having BBLs as well to give them a more athletic figure, a more toned figure. The term soccer dad or soccer butt has become very popular with the male BBL community. Now, what I want to talk about with BBLs in particular is finding the right surgeon, because safety in BBLs is the most important thing. So when fat grafting was first starting to become a thing, I mean, this was more than 20 years ago. Fat grafting has been around for a long, long time. When you take it from one part of the body and put it into another part of the body, acts like any other graft. It has to then grow new blood vessels into that fat for it to survive. Not all of the fat will survive. With my fat grafting procedures, whether it's breasts or buttock, we typically get around 60 to 80% of the fat to survive. When you inject fat into a more vascular area, somewhere with more blood vessels, like the muscle, you get a better chance of survival. So early surgeons, when they were starting to do this Brazilian butt lift procedure, the thought was, hey, if I put the fat in the muscle, it's gonna have a better chance to survive. We're gonna get better results, which is true. There's more vascularity there. There's more likelihood for the fat to survive. However, what became very quickly apparent, because patients started dying, is that if you puncture a vein, and there are big, big veins in the gluteal muscles, and then shove a bunch of fat into that vein, that fat will then travel back and you'll get a fat embolism and you will die, which is not good. So what surgeons started noticing, however, was injecting fat into the muscle while it was giving them better results, there were some tragic consequences. Patients started dying, and the mortality rate of this procedure actually was close to 10%. When you've got a procedure where 1 in 10 patients are dying, that is not a procedure you want to do. And so how then can you safely perform this procedure? And the answer is simple. You don't ever, ever, ever inject into the muscle. I don't even inject into the fascia, which is the thin layer of tissue on top of the muscle. I only inject into what's called the subcutaneous space. So how can you find a safe BBL surgeon, and what are the right questions to ask? First and foremost, your surgeon should be board certified by the American Board of Plastic Surgeons. That's just a straight up question to ask them. If they give you a runaround answer, then that's a red flag. You can look for the logo of the American Board of Plastic Surgeons or the American Society of Plastic Surgeons on their website. If they're not board certified, they're not allowed to display those logos. Then you can ask them about how they perform the procedure. Do you inject into the muscle? If they do, I would not have my procedure done by that surgeon. The American Board of Plastic Surgeons has provided recommendations for surgeons across the country and throughout the world on how to safely perform this procedure. one of the things that we do is, like we said, we only inject it in the subcutaneous space. And so a lot of the things during the operation are done to ensure that. When we graft, the patient is put into what's called a prone jackknife position. So their body is like this. That angles the buttock up in the air so that as I'm injecting fat, I'm staying at an angle that's well away from going into the muscle. It keeps me in that subcutaneous plane. The way that I inject in particular is I use a handpiece that vibrates back and forth. The vibrations of that handpiece provide me some haptic feedback as well. Like when you're playing a video game and you kill the bad guy and it vibrates and you know you got a good shot. The handpiece will actually, I can feel it. If I go too deep, if I hit the fascia, I get some feedback that's telling me, oh, you're not in the subcutaneous plane anymore, you need to come back. And so that's the reason I use that particular handpiece. All of this is designed for safety. One of the other things that has started in Florida and I think is going to eventually move around the world is what's called live ultrasound monitoring. Because of a lot of practices and surgeons in Florida performing this procedure unsafely, there have been a number of deaths, a lot of them publicized around BBLs. And so Florida is actually in the process right now of enacting a law where you have to perform live ultrasound video recording of you grafting fat. If you don't have that recording and you have a patient die or you get sued, you lose your license. If that recording shows you injecting fat anywhere outside of the subcutaneous space, you lose your license or get in some serious trouble. And so for me, anytime procedures are put into place to make the operation more safe, I want to adopt those as early as possible. I don't want to be safe when the government tells me, hey, now you have to be safe. I want to be safe early. So we're already utilizing live ultrasound video recordings of our own fat grafting procedures in the operating room to be as safe as we can. So thank you, Drake and Kendrick Lamar and Metro Boomin for bringing BBLs to the public eye. Again, BBL is a great procedure when done safely, and it's done for men and women. I perform this procedure a lot, and if you have any questions around it or you want to have a consultation around a BBL, come and see me anytime.